So good morning, celebrants. So on behalf of Barbara Garcia, Director of Health for the San Francisco, and Dr. Ed Chow, President of the San Francisco Health Commission, I'm delighted to welcome you here to San Francisco General and celebrate the 50th anniversary of a continuing grand experiment that's touched the lives of millions of Americans. Since their launch 50 years ago, Medicare and Medicaid have represented nothing less than a revolution. In our nation's history, few programs have had so much impact on the lives of the people of this country and of our city. In San Francisco alone, there are over 120,000 people eligible for Medicare. That's over 16% of the city's population. In addition, there are close to 206,000 San Franciscans enrolled in Medicaid. That's 1/4 of our citizen population. Today, we are proud and delighted to host this event here in the city's hospital, San Francisco General Hospital and Trauma Center, where over 50% of our patient population is comprised of Medicare and Medicaid enrollees. At this time, please allow me to introduce and welcome some special guests and partners we have with us today. First, there's Catherine Dodd. There we go. Catherine is Director of San Francisco Health Service System and former Regional Director of the U.S. Department of Health and Human Services San Francisco office. We welcome you back home. We also have Dr. Sue Carlisle, our partner, Vice Dean, UCSF School of Medicine. And we have Catherine Sines-Duke, Director of the Alameda Health Care District. Will you please acknowledge us? And finally, we have Tracy Jensen, Trustee of the Alameda Health Care District and Alameda Health System. We want to thank you all for joining us today here at SFGH at this commemorative, visionary public policy and celebration. Now it's my great pleasure to introduce to you the mayor of our great city, Mayor Edwin M. Lee.
Good morning, everyone. Good morning. I just wanted you to make sure you saw my Giants tie. Roland, thank you for that introduction and for all your good work you're doing at our health network. It's great to see so many people here, faces very familiar, everybody in the room here to be celebrating our 50th anniversary of Medicare and Medicaid. And I can't think of a better place than our world-class SF General Hospital to do this at, because it's been a centerpiece, and I know that all of you who have been associated with our hospital know that this is our signature, and we're excited this year. But I will say I will speak all day long about baseball and success analogies, because what we've been able to do in healthcare is like winning World Series in the city, and certainly for our federal partners, our community partners, our friends here at SF General, but the entire healthcare system has benefited from really the programs, but also the people that were committed into the programs, not just to fulfill the goals that been stated, but once those goals were fulfilled, to figure out where the gaps are and to make sure that the mantra of this city was that everybody gets access and that we will figure it out eventually. And I'm a great fan of the Obamacare, because it's allowed us a fantastic foundation to figure out a lot more things. And I'm very interested on the topic that will be presented today by Dr. Hernandez, because it's both a challenge but something that we all know we must do even better at. And the city government has an important role to play in making the lives of all people better. And the first time in a decade, I yesterday got to sign the most historic, biggest, baddest budget in the history of San Francisco. 2-year budget, no budget cuts. People came in and honestly told us what they needed to get done, and we're filling those promises and making sure we're taking care of the gaps as well. It's a balanced budget with increased revenues. It allows us to do what in past years we hadn't done before, make smart, strategic investments, increase those services, but also make sure we're thinking about sustainability, that we can sustain this for the long term. And these are good economic times for the city, but it is also the greatest opportunity to make sure that prosperity is shared by even more people, if not everyone. We need to touch everybody's lives in a positive way. And I think a great example of that value is what we've been able to do right here at SF General with the creation of Hummingbird Place. It's our new peer respite center that's focused on behavioral health issues. It's our example that if we can do something here, we can certainly replicate it in many parts of the city where we see far too many examples of what happens when we are not able to pay attention to this incredibly important issue. Later this year, I'll be excited to join all of you and more in opening up our new SF General Hospital. Yes. It's a great thing for the city in so many ways. And again, the Giants analogy is always going to be there because it's a world-class institution. It signifies this incredible partnership we have with UC San Francisco. It's the #1 trauma center in the entire Northern California. It has the reputation of just being really great responders, but it also emanates the education aspects, the level of care, the level of attention, the multicultural approach to serving everybody here in the city. And I think this is why, I know this is why the voters overwhelmingly passed the largest revenue bond, general obligation bond to do this. We honor that by making sure it's done on time. And we honor that by making sure it's open and it's alive and that everybody working in there is happy and that they get the machinery it's needed. And that's why friends of the SF Foundation have been so important. And this is the Giants link because Pam and Larry Bear, Rich Guggenheim and Judy, and all the friends have led that effort. And they landed a big one. You know, to be able to say this is also a name of Priscilla and Mark Zuckerberg and their generous donation, along with thousands of others' donations to make this work. That will have the state-of-the-art machinery there, things that the bond can't do, but it complements exactly what we need to get done, fill every part of the gap to make this hospital successful. Ultimately, on that day, I will praise everybody that works there, because that's why people will go. Yes, it's the building. Yes, it's the machinery. But if you don't have the people whose #1 thing is to care for your health and that they have the attitude that this is why we have a world-class center, you'll never gain that reputation. You'll never breed the confidence in the people who are, by uncontrollable circumstances, caused to be going there. But we also want to prevent people from having to go there, as many people as possible. And this is why I think celebrating this milestone of 50 years, but also understanding the World Series games we've won since that time is so important. You know, it was a World Series win when we got the San Francisco Health Plan together. The doctor and Barbara and Catherine, everybody working with our federal partners figured it out, that we weren't just going to be satisfied with saying we'll get to universal health care when the federal government does. No, we wanted to be the example that we can do it. It could be done. That the President Obama doesn't have to be alone on this, and that we can be the forging examples. And guess what? 54% drop in uninsured persons since healthcare reform was implemented. 54% drop in San Francisco. That's an incredible part of this history, and we couldn't have gotten it done without the 1965 legislation. Just could not have gotten it done, but it gave us the foundation to be able to dream, prepare, plan, and implement. You have to do all those things. You have to do them with a lot of partners. And you have to have mayors like my predecessor believe in it could be done, working with Director of Public Health at the time, Sandra, and then now Barbara taking it up, working with the Health Commission that believe, working with an entire health community that says, yes, let's all back this up, and keeping a good dialogue with city government so that we all are partners in this. We created one of the first Medi-Cal managed care plans, and now we've built Healthy SF, and now we can truthfully say no one is left out of our health care plan and health reform. Everybody's got access, and we'll find more ways to make that affordable. Now we just got to make sure people use it. Use it before they come to emergency care. Educate ourselves. That's why I have to be the example of better health myself. So, but I just want to say that all of you are here not just to celebrate these milestones, but to really reinvigorate what we are all really trying to do in making sure access and people take advantage of that access. It doesn't work if people don't take advantage of it. It doesn't work if they aren't thinking now how I can be healthy 10 and 20 years, or how my kids can be more healthier, how we can do all the other things that we need to do, whether it's preventing obesity, making sure we prevent the behavioral health from getting well out of control. These are things I am very willing to do, spend money on, experiment with, make some mistakes along the way in an effort to get to the right answer, and making sure that we have partners in the entire Bay Area to work with us to make sure we do it right. And I just want to say to our federal partners at HHS who are helping us navigate Obamacare and other social reform initiatives, that it is these partnerships that allow us to be both experimental but also accountable. And I look forward to working with you on these big challenges. I look forward to working with you, Melissa, and your staff and the entire region to make sure that your tireless efforts don't get rewarded with the best examples possible. I'm also very much happy to not only listen carefully to Sandra's words, as she's been just a lifetime steward on transforming that healthcare into making sure that we are doing all the right things. I'm quite interested in her leadership, of course, and Barbara's leadership here about how we can make sure we're doing all the right things. Catherine's got us on a really good beat on even making sure that we're doing all the right things with our city health workers to prevent the costs from overcoming us. So it's more than just a celebration. It's a confirmation that we're headed in a direction to invite more people to take care of their health, making sure our systems are accessible, they're culturally sensitive, they're dealing with the greatest issues of our time. And that allows me to say, I'm not just building more housing. I want to build services. I want to build communities. I want to make sure people's health, public safety, job opportunities, their family investment are all taken care of in the greatest city in the world. And I will say, coming back from the invitation of Pope Francis to talk about things from climate change to human trafficking around the world, we are very, very lucky to be in San Francisco, where minds of people are saying we can do better. We can be a city for everybody, and we can also build infrastructure and build confidence in people who want to come here and say we can take care of you if you've got issues, whether it's health or housing or even criminal backgrounds. We did a dedication with Mimi Silbert for Delancey Street yesterday, and again, we had a chance to talk about transforming lives. We're in the business. Cities are in the business of transforming lives and welcoming people that have fulfilling lives, and this is what we always want to do in our healthcare business. Whether it's preventive, or whether it's responsive, or whether it's the aftercare, we're going to do all these things because we are the greatest city in the world. Thank you.